My name is Dr. Marlene Mireles, physical therapist, and you're aware that we are recording and that this video is for marketing and educational purposes, correct?
Yes.
Okay, and can you state your name for me? What is today's date?
April the 26th,
Yep.
2020.
Yep. And then what body part are we focusing on today?
The knee.
Okay, awesome. And so from your paperwork, you said that, is it your knee pain that started about 5 years ago?
Yes.
Okay, and then I know the last time we had talked, it sounded like there was an exacerbation of symptoms when you were riding on one of those scooter things.
Yes. A Segway.
Okay. So when were you, so before the Segway, had your knee kind of calmed down, or was it already hurting?
It was already starting to hurt more, like when I even did yoga, so I stopped doing yoga. But then it kind of calmed down a little bit because I haven't been doing a lot with it. But when I did the Segway, and I think because of the bumps from the Segway, it, or maybe trying to balance, it started hurting really bad the next day.
Okay. So it started about 5 years ago. It's kind of gotten better than worse, and the Segway kind of.
Yeah, but I feel like my knee has always been swollen this whole time. Like it's never stopped being swollen.
Do you ever ice it?
Yeah, I've been icing it, and I've been putting arnica at night on it, arnica lotion.
Okay.
Taking turmeric.
What was that?
Taking turmeric.
Okay, for inflammation. Is it?
I don't think so. I mean, it's still swollen.
Yeah. And then when was the Segway incident? About how long ago?
I would say 3 to 4 weeks ago, maybe.
Okay. And then when that happened, were you already seeing your physical therapist when that happened, or did you?
I was. Yeah. Yeah.
Okay. And then when you saw the chiropractor, was that for your knee also?
So I did see a chiropractor for my knee a few years ago, and she said the same thing as my recent doctor, saying that my knee's not tracking. So they tried helping build up the muscles around there, and it helped for a while, but now it's getting bad again.
Okay. And did they also strengthen your hip and ankle?
No.
Okay.
Just the muscles around the knee, except now I know that I don't have muscle around my knee again.
Okay, it feels weak.
Mm-hmm.
Okay. And right now, just standing there on a scale from 0 to 10, 0 being no pain and 10 you want to cry, where would you put your pain at?
0. It's usually when I'm doing movement.
Okay. I think you had mentioned in your intake forms that doing the stairs and sometimes walking.
Yes. And more sudden kind of movements.
Okay. I'm writing down stuff.
Sure.
And now when you're moving and it starts to hurt, on a scale from 0 to 10, can you tell me what it is at its worst and what it is at its best?
I would say 4 to 5 at during the movement.
Okay. And is that
that's probably the worst.
Okay. And best 0 when you're not moving.
Right.
And how would you describe your pain? Like sharp, achy, radiating? Sharp.
Mm-hmm.
Does it ever radiate down your leg or up your leg?
I don't think so, no.
Any numbness or tingling?
Not on my knee, but my toes do get numb and tingle, but I think that has to do with my low back.
Okay. Yes, I know that you have had back issues in the past, so it may all be like the back and the hip gets weak, and then if your hip and ankle aren't moving right, and then I know you mentioned plantar fasciitis.
So that my foot hurts also in my right leg, throughout the day. Like it doesn't really stop. Yeah.
So let me put foot constant. Okay, and then you mentioned meniscal erosion. Was that from an MRI?
No, the doctor just said that that's what it was when she was looking at my knee.
Okay.
Because she said I am a candidate for stem cell injection or stem cell injection, but I need time to get the swelling down, and my knee to be strengthened again, and tracking right.
Okay. And then I know that I sent you some cups, and I sent you a little video so you could try playing with the cups. Did you try playing with them yet?
No, I didn't really know exactly where it needs to go. So
yeah, but you have the cups today, right? So we can do it together. Okay.
I have them.
Okay, so I kind of want to see how you're moving. So go ahead. First, I'm going to have you stand on one foot. So I want you to scoot back so I could see your knee and your ankles. I'm going to look at your balance, and let's try to do 30 seconds, okay, on each leg.
Can you see me back here?
Scoot back a little more. There we go. And go ahead and take your tennis shoes off.
Okay.
Okay, and go ahead and take your socks off too.
Okay.
Okay. So first I'm going to have you stand on your left foot. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Good. Was that difficult at all?
No, that was fine.
So now I'm going to have you do your right. If you're able to, though, this time when you bend the opposite leg, try to get it at a 90-degree angle.
Okay.
So are you ready?
Yeah.
Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I could tell that one was a little bit harder.
Yeah, and I could feel some pressure and pain in my knee. Not too bad.
Okay, put some pressure and pain. And your foot, is it hurting right now?
It was, yeah, when I was on the right foot.
Okay.
My foot was hurting.
Okay, so next I'm going to have you, I want to see your squat, and I want you to do it facing me and then to the side.
Okay.
Okay, go ahead and go down. Good. Is that about how low you can go?
Maybe there.
Okay, do you start to feel pain once you get there?
Yeah.
Okay, go ahead and face the side so I can see your side view now. And then I want you to stop just right when you feel like it's going to start to hurt, then stop.
Right there.
Okay. So about 80%. And that's just on your right knee, not your left, right?
Right.
And your foot is still hurting throughout?
Uh-huh.
Does it get worse when your knee pain gets worse, does your foot pain get worse?
I don't know. I haven't looked. I haven't checked that. But I know, like, I don't know if, can you see my foot right now?
I can see your feet. Yeah, now there we go. Perfect.
Okay. So when I move my foot, when I go like this, it hurts more.
Okay.
And
it hurts more on the inside? Okay. And is your pain on your foot more in the inside regardless than the outside, or?
Yeah, it's usually like right here, and then like, it's usually this right here,
Okay.
or right in here.
Okay. And what can you point to where it hurts on your knee?
Right in here.
Okay, so right below your kneecap?
Yeah.
Okay. Does it ever hurt on the medial or lateral sides of your knee?
No, this and this?
Right.
No, not really.
Because that's where usually when people have meniscus issues, they'll to like if it's the medial meniscus, kind of like the medial joint line.
Oh, okay.
Sides. So that's why I was kind of curious.
When you poke at it, it hurts more on this side.
Okay.
But just in general, it doesn't hurt. But when you touch it,
then it does.
Yeah.
Okay. So medial knee with touch, and then below your kneecap with movement.
Yes. Mm-hmm.
Okay. So next this is also to look at your ankle mobility, and I want to also see if your knee's moving, if your leg's trying to move in or out. So you're gonna go up to a wall. Let's see, you could even do the doorway there. Okay, so then I want you to get in a lunge position where one knee is on the ground. So we'll do whichever leg you're more comfortable with, forward first. Okay. So now you're going to go into that lunge position. Make sure that your back leg isn't too close to the front leg, and try to keep your heel on the ground. And go down nice and slow.
Like this?
Yes, but I think your back leg is still really close to.
Okay, let me do this wall.
Okay.
Like this?
Yes, and make sure that get that back knee to go down to the floor. There you go.
Okay, so that hurts me.
Okay, so go down right before it hurts, and then come back up.
Like right there, that hurts.
Okay, and go ahead and switch legs.
That doesn't hurt.
Okay, so even when so your back leg is actually, let me see that one more time. One more time. Okay. So it looks like you're getting a little bit more range of motion when your hip isn't flexing on the right side. Just a little bit, and there was no pain with that, right?
Right.
Whereas when you got to 80 degrees, when your right knee was forward, you had pain, but you got to about 80, 85 degrees with your right leg back, and there was no pain.
Yeah.
So that's interesting. No pain with left leg forward. Okay. Now, and you can do this next activity either laying down or standing up, whichever you're more comfortable. But I want to see if you bend if you want to look at me.
Okay.
So I want you to bring your knee to your chest and then apply overpressure and tell me if there's any pain with that. And I'm really close up right now, so I can't really see too much. Okay, and then now put your hands on top of your lower leg and push down.
On this leg?
Right, and then you're gonna push down. There you go. Is there any pain with that?
No.
Okay, good. So, okay, and now I'm gonna have you stand up. And then can you see me?
Yeah.
So now you're going to almost pretend like you're doing a calf stretch. So I want to see overpressure into extension and tell me if there's any pain with that.
Okay. No.
Okay, good. And now have you noticed when you're going up or down the stairs, is there Is it more when you're going up or more when you're going down? And when it does hurt, is it when your leg, when you're like you're in that almost that forward lunge position, but like going up?
I know when I go up, it hurts, and then when I'm going down, they both hurt going up and down.
Now we're going to do a little meniscus test. So
Okay.
Go ahead and watch me. So your foot's going to stay still. Stay still as you do this movement. You're going to kind of twist and see if there's pain this way, and then twist and see if there's pain that way. Trying to keep your foot as flat as you can so you're getting a little bit of rotation.
Okay.
Any pain with either of those?
No. I'm surprised because I usually do get pain when it's not straight.
Okay. Okay. And then next we're going to have you do a heel raise with both your feet. You're going to turn away from me because I'm going to watch your ankles and see if one foot's going higher than the other.
Okay. Can you see my feet?
Yes. Good, and come back down. Can you go ahead and do that 20 times? Good. How did that feel?
Tiring.
Tiring?
Yeah.
Any pain? I know there's fatigue, but any pain?
When I would go up, so it felt like this right foot itself was more stiff when I was moving it up and down, where this one just felt like it was easy to go up and down, and this one was kind of hard.
Okay. So it felt stiff, but did it increase any symptoms?
When I would go up like this, I can feel it hurting here.
Okay. Okay, the next thing we're gonna do is a single leg heel raise. So let me see your left first, and we'll go about 20 times.
Like this?
Uh-huh. Good. Okay, now the opposite side.
So when I go down, when I'm up, it's okay. It's when I'm going down is when it hurts.
Okay.
It's this downward movement, like right there.
To your foot, right?
Uh-huh.
And your knee's okay?
Yep, knee's fine.
Okay, go ahead and relax.
Okay.
Okay, and then I also want to, if you sit down, can you bring both of your feet like up so I can see your lacking range of motion in the right versus the left? And let me have we'll do a front view and then a side view.
So you want me to, what do you want me to do?
So you're here, your feet are rested, and you're just gonna bring your toes up. Okay, and then do it. Is one a little bit more than, looks like your left's going up a little bit more, right? Just slightly?
I can't tell.
Let me see from the side. Look, if there is a difference, it's very slight.
Okay.
How do you feel? Do you feel like they look pretty equal, or?
Yeah, I think they look equal.
Okay, is it feel tighter on one side versus the other?
No, I think they feel okay. But when I do this, again, I still feel it like in this area.
Okay. And what about if you point your toes out? So stay, like get like just normal, like you're at rest, and then make your feet move out. Like if you can you see my foot?
Yeah.
Like out.
Oh, okay. So actually when I pointed it, it kind of hurt my knee.
Really?
Yeah.
Okay.
So out.
Feels look equal. You could probably face me now so I could see the bottoms of your feet because then I can tell this way. And try not to see how your lower leg is externally rotating. Try to keep those tibias still.
Got it.
Okay. They look pretty equal. What about going in? So you may want to like separate your feet a little bit and go in. Is that hard?
No, but it causes a lot of pain in here.
Okay, is that the only, pointing down caused your knee pain and going in caused medial pain? Okay.
Yeah, the foot pain, yeah.
Foot pain. Okay. And now let's just kind of see where your hips are. So okay. I'm going to have you, so can you see me?
Yeah.
So you're going to do, I want you to do this motion and then come to center and go back this way. And we're, okay. I kind of am limiting some limiting motion, but trying to keep your back as straight as you can and just going back and forth and tell me if you feel any differences from side to side. I can't really see you, I just see one leg.
Okay, let's see.
Good. Do you feel any difference from side to side?
I feel like my knee feels different on this side. And then as I move it up, like I'm moving it, it kind of hurts. This is okay.
Okay, so when your hip is internally rotated, because that's your left hip though. Okay, so right there your knee feels okay. So actually it's external. So when your hip is externally rotated, your knee is okay, but transitioning to the opposite movement.
Yeah, and so this feels fine going this way, but it's as I'm coming down, right here, it starts to feel pressure. And then it kind of hurts when it's down like this. I mean, it's very slight hurting, but I can tell like it's not the same as the other one. Okay. And then coming up again, it kind of hurts coming up.
To that part below your kneecap or the medial part of your knee?
Actually, it's more in this area.
Okay.
Yeah.
Okay. So now sitting there, I want you to rotate to one side and then rotate to the other side. Okay. And then tell me if one side feels harder than the other.
I think they feel the same.
Okay. Okay, and then let's see. Do you have a chair that you could sit on?
Yeah. Okay. Okay.
I need you to sit on the chair and you're gonna march. So you're gonna bring one knee up to your chest and then switch to the other side. And do it about 15 times and tell me if one side is harder than the other.
So just one.
As high
back and forth? Mm-hmm. Okay.
As high up as you can go.
So this one doesn't go up as high, I don't think.
And when you go up with the left, go as high as you can and hold it. Hold it, hold it. 1, 2, 3. And now go with the other one. 1, 2, 3. Okay, I can see that, yeah. So, okay, and so now when you march, you're gonna actually do kind of a straight leg raise. So your legs are gonna be straight and you're gonna march like this, okay? Is there any pain with that or does it feel different?
I think this feels okay, feels the same. Can't tell.
And now when you do it, I wanna make sure, I want your ankles to be up.
Okay.
How's that feel?
Yeah, I think they feel okay.
Good.
I can feel that it's stretching in my knee, or it doesn't feel as strong as the other one. Like as I move it up, it feels kind of weak right in here.
Okay. So I think it's definitely like your hip and your ankle are also contributing to your knee. And so, it's all the chain of like your back, hip, knee, ankle. They're supposed to work in balance. And when there's an imbalance and something needs to work harder, then that's when you can sometimes get your body screams at you like, hey, so I want to try to address your muscular imbalances so that way we can get everything working and syncing together.
Mm-hmm.
First, since I can't touch you, I'm gonna have you, I brought you those cups so that way you could do like the manual therapy. So do you have some lotion?
Yeah. So should I stay in the chair? Is this a good?
I think if you sit on the floor, that'll probably be better.
Okay, then I'll go back to the cups.
And I have my cup too. Let me get mine.
But what I really like about your analysis is that you've looked at a comprehensive part of my body, because when I went to a different physical therapist, they only looked at my knee. Like they didn't look at my foot, they didn't look at my hip. So they're only trying to address the knee. So I think that's also, like you said, is an issue because it's my whole that side of my body.
Yeah, and I think on our next session, so in Texas, I have 10 days to see you without a doctor's referral.
Mm-hmm.
Our next session, we can also take a closer look at your back and see how that fits in because it's all
connected.
Mm-hmm.
Okay, so I have my lotion and my cups.
So now with there are gonna be some areas that are gonna be very tender. So you can try it on those areas, but if it hurts too much, you don't need to stay there. You can go on a part of your muscles that are not as tender, but it's still gonna help because we're addressing the fascia right now. Okay. And we're also increasing the blood flow to the area so that way before we do some exercises, it has sufficient blood flow and it helps to increase the contraction of the muscle. Okay. So when you get over a tender area though, I'm just gonna kind of show you on my arm. So go ahead and start on like your upper, maybe like right here, just so we can rub some lotion there. And then you're gonna squeeze your cup when you're ready and put it on and release. Okay. And then that looks like, what size cups came with that one?
Is this too big?
Maybe there's another one, right? Yeah, let's use the medium.
The medium one? Okay.
The big one's like good for your back.
Oh, okay.
I don't use the large one too much, but occasionally I would. So you can just start kind of moving it on there. If you get to a part where you feel like it's more tender, you can do it while maintaining a squeeze so it doesn't do as much suction.
So my T-bands are very tight. Like
these are it's gonna hurt over your IT band. So you can maintain a squeeze so that way you can control the suction. So you may not want a large suction over your IT band if it's too tender.
Yeah.
And there's some areas where you may only tolerate it for like a minute, and that's okay, but you can still move to a spot where it doesn't hurt as much and it's still going to help. So we'll go ahead, and I want you to do that all over your quads, your upper thigh, and your IT band.
Okay.
So we'll do, and then we'll do like a quickie version right now, but when we are done with the session, you should still spend some time doing that.
Okay. And so I'm just going over it like this.
Right, just long up and down. You can do zigzags, you can go side to side. So when you leave it still, then I would have you do an exercise with it on. So then the cup moving, the tissue inside the cup is moving. So
got it.
Switching roles. And go ahead and get your IT band a little bit too. And sometimes too, like if there could be different parts of your quads that are working more, if your IT band's really tight, it could be pulling your patella one way, you know, so, but all that still comes from a muscle imbalance.
Mm-hmm.
How does that feel?
It hurts right here.
So you can find a spot where you can tolerate it and leave it there, and then maybe pump your knee a few times.
So pump my knee, how?
So like maybe leave, can that cup stay there?
Yeah.
Can you get the bigger cup? And then put it, I'm like pointing at the screen like you could see me. Yeah, just a little bit further, like right there, it's good. Okay, and then you're laying down, so while the cups are on, you can just kind of pump your knee here.
Okay. Oh boy, that hurts.
And if it hurts too much, you can always move the cup to a different spot and keep doing it. And why don't you support your leg with your hands behind your hamstring?
Okay. That's a little bit easier. That doesn't hurt as bad. Good. But yeah, it hurts.
Okay, and then move the cups just a little bit. Put it okay, and then now what I'm gonna have you do, you're gonna do like an IT band stretch too. So you're gonna bring your hip across your body and then pump your knee.
Okay. Oh yeah, that hurts.
I'll just do about 10 more pumps.
Okay.
So go ahead and put the big cup away.
Okay.
And then with the smaller cup, I want you to get now kind of the lower part of your leg kind of right in here.
Okay.
And move back so I could see your knee a little bit better.
Okay.
How's that feel?
That hurts too.
And if you want to try going over the exact spot where it hurts, go ahead and do that. And I like that you're maintaining the squeeze just to fill out to see how much can you tolerate. So that's good.
So is the more squeeze, the easier it is, or the
more, if you maintain the squeeze, it makes the suction less.
Okay.
So sometimes on those tender areas, you may want to maintain the squeeze so that way the suction isn't as. And you could always, like, if you're doing your exercises, you can have your cups in one spot for like up to 10 to 15 minutes, as long as you can tolerate it. And you'll get some circles, but they should go away within like 1 to 2 weeks, just depending on your body. But so don't be afraid if you see circles.
Okay.
And so when that spot where it's hurting you, do you feel like it's like a band going across, just like a band of pain right here?
No, it is the sharp pain right here.
So what I want you to do next, where it hurts you, You're going to get your finger and bend your knee a little bit. There we go. I want you to get your finger and I want you to push, like just push super hard. It might hurt, but I want you to just push really, really, really hard on that spot. You even have to, it's probably better to use your thumb. Okay, and just dig in there and push, push, push. You could even like push while you're kind of bending and straightening your knee. Push, push, push. I mean, sometimes people cry. Like, I just want you to really push in there. And so sometimes when there's a distortion of fascia, it can also affect the way that your body moves. So sometimes when people describe just like a pinpoint, sometimes that could be there's a herniation of the muscle through the fascia or any soft tissue there. So it's like you're trying to push it back in almost.
Oh, okay.
And we'll try it and see if it works and see if it makes it feel better.
Okay.
And now I want you to get your butter knife.
Okay.
And then with the non-sharp side, it shouldn't be too sharp because it's a butter knife, you're just going to do like little strokes right around here.
Oh.
You're also going to do this to the bottom of your foot. Okay.
Should I have lotion on or?
Yeah, make sure you have lotion on.
Okay. So, oh my gosh, on this side hurts. Like the inside?
Yeah.
Oh, and ouch, on this side too.
So we'll do this. This is another fascial release technique. So we'll do this for a few minutes. I'll probably, after this, I'll have you do some of the movements that hurt you before to see if we get more range of motion. And then after our visit, try it on the bottom of your foot too. And you could even, I mean, the cups don't, sometimes you can get like your heel with the cups or your Achilles tendon, the lower leg, because that will also help with your ankle.
Yeah, so like on top, it doesn't really hurt that bad, but it's on those sides that hurt.
Yeah. You're doing a great job.
Okay, great. Okay.
And actually, before we go back to the functional squat or the lunge, let's go ahead and have you just pump your knee, laying down again, and just do this about 20 times.
Okay.
And then I want you to try your functional squat again.
Okay.
Go ahead and go to maybe this side. There. I could see, there we go. Go as far up and as much as you can go straight and as much as you can bend, but I want your toes to be pointing and don't have your ankle flexed up. Okay?
Like this?
I can't see your foot, but like this. Yeah, perfect.
Okay.
And don't try to go super fast.
Okay. Okay.
Go ahead and stand up.
Okay.
And let's try your functional squat again. Can't see you. Okay, go ahead and face sideways for me.
Okay.
And go ahead and go down.
Oh, I feel like I can go down further.
You did. Go one more time. Let's do 15.
Wow.
Better. Make sure those knees don't go over those toes. Good. You're getting more than 90 degrees too, it looks like.
Yeah.
Before it was just like 80.
I know. And it doesn't hurt either.
Good. How does your foot feel? Does your foot feel any better?
Actually, I think it does. Okay.
Good. Okay, now I want you to go ahead and try those single leg calf raises again.
Okay.
And I can't see you, but it's okay. Just let me know how it feels.
Okay. On my right foot.
Mm-hmm.
So still when I go, it's like right here is when it hurts.
Does it feel better or the same?
It feels a little bit better, but it's still, it's still hurts a lot.
And then now let's go ahead and do the lunge by the wall.
Okay.
I said 15, but then I was like.
I can't remember which one it was that made my.
It was when your right leg was forward that it. Yeah. How's it feel now?
Yeah, it doesn't hurt.
Okay.
Yeah, that doesn't hurt anymore. Yeah.
Yay. And then what about with the internal and external rotation when you're sitting on the ground and you're moving your legs back and forth?
Let me try that. So still when I come up, when I'm coming up like this, it hurts right here in the top.
Okay, and does it feel like a sharp pain in a specific spot, or is it like a band of pain?
It's more of a band of pain.
I want you to get your thumb.
Right, it's like right here, and then it starts getting worse as I go down.
Okay, I want you to, let's get the cup. Get one of the cups.
Okay.
I want you to put it where it's hurting you, and then do the motion with the cup on. Good. Now leave the cup in one spot.
Okay.
Do the motion. Go about 10 times doing that back and forth motion. Like sideways, so I could see you from the side view. There we go.
Okay.
Go ahead and take the cup off. Okay, get your thumb, and I want you to start at the outside and push really hard and go all the way to the inside for as much as it hurts. Like the full
start here
and move. Yep, and move your thumb all the way in. Push really hard as you go in.
I mean, this hurts just in here.
Okay, just keep going all the way across. But if at any point you feel a lump, then you'd stay in that spot and push hard.
Right here.
And find that lump and then push in. Good. And then start moving your thumb
Got another one. Okay.
Good. Now try the movement again without the cup and without your thumb pushing on it and see if it feels better.
Let's see.
So what I'm going to have you do for your exercises, work your hips. So we're going to do clams. Do you know what a clam is?
Yeah.
Let me see what your clam looks like. Your hips stay still. When you open your knee up to the outside, try not to rotate your hips. It may just be a little movement, but then you stop right there and go back down.
Okay.
If you do use a band, I want you to use the lightest band. We're going to do both sides, okay?
Okay.
Then I want you to do lunges, but I want you to stop before it hurts.
Mm-hmm.
And you'll do about 20 to 30 reps each leg, but stop before it hurts. Okay. And then I also want you to do the single knee to chest and then just pump your leg up and down.
Okay.
30 reps. And then I'll write this down for you too. And then I can send it to you.
Okay.
We're going to do plan pending.
So this is the thing that you're talking about, like this, right?
Mm-hmm. Yep. But I want you to point your toe, and then you're going to extend your knee as far as you can.
Oh, this.
Yep. And then bend it back down as far as you can, but with your toe pointed.
Okay.
Knee to chest. 3 times, toe pointed. Okay. And then we're also going to do your calf raises.
Okay. So is this what I'm supposed to be doing?
Yep, you can go down or you can go up. Is it easier if you cross your foot like this?
Yeah. Yeah, that's easier. So for the suction cup, I stick it right here.
Yeah, you can just kind of move it side to side, and
I don't think it's suctioning.
yeah, it's hard to get the foot sometimes.
Oh, okay, there for a little bit. So the Achilles tendon is back. Is that back here?
Yes.
This, like all back here? Okay.
And it's going to be hard to kind of get the cup to really suck, but it'll get some parts. You could use a knife. You can go a little bit just right where you can get the suction to. And if the calf raises end up not working out, we can always go to like the ankle exercises with the band. So that might be a little bit less weight bearing, so it may not hurt as much. So we can play with it, and we'll just communicate and see where we need to.
Okay. Okay. So do I go any further up, or is this where it's supposed to be?
I mean, you could do your whole calf, but like right around that area, you really want to kind of.
Okay.
You could try the knife too. Sometimes the knife is the butter knife, the back of it, not the sharp part, or you can use like to get in those hard areas, like you can use this part of the butter knife.
Uh-huh.
Like it just depends on your butter knife. Like mine has decoration there, so it didn't feel very nice, but if it's smooth, it might work. You can try it and see. Yours looks like a good shape.
Yeah. Okay. It feels better. I would say it's probably a 3 now.
Okay.
Like right here. Instead of it being the whole range of my foot, it's just more in a specific spot. So it is.
I think for your ankle, I'm going to send you some band exercises for your ankle, and then we'll progress to doing the single leg one.
Okay.
Okay. So I'm going to
I have this band. I have this green band and this like a little thicker band.
Okay, so the green band might be too much for the clams.
Okay.
You can try it and see how you feel. And the gray one is just going to be too strong, too much, I think. Okay. You can try it and see how you feel. It might not be 30 to 60 reps, or we can do it without, because you can do it without and get to 60 and be tired, I'm sure.
Okay. Okay.
So we'll play with that. I'm going to send you a write-up, and I'll also send you the recording so you can reflect back on it to see if you have any questions, and then we can schedule our next session.
Okay, sounds good.
Thank you, Sharito.
Thank you. I appreciate it.
No problem. So let's go ahead and stop recording.